Good afternoon, everybody. We're going to talk today about contract management and how to maximize revenue for efficiencies using our contract management tool. I'm John Wallace. I'm our Solution Strategy Director. I've been with the company for about 20 plus years. And today we're going to talk about an introduction of Contract Manager. We're going to talk about an overview and the Contract Manager modules and some of the highlights using this solution. So from an introduction perspective, when we look at this screen, it seems pretty busy, but what we want to talk about is, where does Contract Manager stand from a class perspective? Second highest overall for many, many years. We talk about how does Contract Manager help improve your financial outcome, accurate revenue recovery, optimize contract terms, and reduce manual errors. And that's really important. By loading all the contracts, by calculating that revenue every day, we can show that utilization. And also, FinThrive is not owned by a payer. Contract was designed by revenue professionals like myself for revenue professionals like you. So think about it in really three facets of that: finance, managed care, PFS. We are fully focused and dedicated to advancing revenue management in the healthcare for both hospital and professional. Also, contract management is set the standard industry, with unparalleled accuracy using the tool. So when you think about it, by looking at it in different areas, from 98% accuracy, across all payers, commercials, Medicare, Medicaids, TRICARE, all that logic is loaded within the tool itself. And then on top of that, the contract platform is very agnostic where it connects to. So if you're an Epic or Cerner or Meditech, from the hospital side to, MP, different types of platforms for hospital and professional, we can connect to any different engine from that perspective. It's also, recognized in industry. So with 20 plus years of using this solution, today we have over about 180 health systems that looks at about 800 hospitals across the country. That is a big, big chunk of business across the entire country. And then we have amazing customer experience. Many of our staff has been in your shoes. So they come from the health system like I did too many years ago. So our experts are ready and excited to help you with to reach your potential. So as we look about from an overview point of view, think about some of the key benefits. And again, think about the high accuracy across all different types of commercials, Blue Cross, Aetna's, and Cigna's, and different types of Medicare Advantage plans. How do we support all that information? So how do we support all payers, in those niche areas, model all payers, including customized scenarios from hospitals to value-based capabilities, wide adoptions. I say this again, 180 health systems representing 800 hospitals or providers. It's very user interface. So think about it using it from a PFS perspective, the business office, to managed care, to the finance. Think about analytics and reporting. And analytics is very key because it does come with contract management, from robust analytics and reporting to define financial insights. How do you see the data calculating every day and track and trend that utilization? Scalability and real-time processing is really important. So for every day that you drop claims, we're going to calculate that net revenue. We can also push back expected reimbursement or net down the AR if you wanted to net down the AR, if that's what you need to do. And then how do you customize workflow? So think about, how do you want to use it today, and how do you want to use it tomorrow, and how do you want to use it 6 months from now? Your organization can fit these different needs. Again, finance, managed care, PFS. So the benefits and the outcomes. So the key part about that is to reduce, eliminate, increase, accelerate, and improve. I think the important part about that, when you start looking at how to reduce human error, reduce administrative burden, manual work, again, getting away from spreadsheets and getting away from different types of processing that takes hours to do, looking at denials and revenue leakage, discrepancies, and ensure consistency. The key part too that I like is the ability to look at manual processing through automation, workflow, redundant workflows, and an uncertainty. Think about how to eliminate, reimbursement delays and fragmentations. I think the key part about that is, by working smarter, not harder is important, but also how do you increase revenue capture, negotiate power. So think about how do you grab today's contract and model to tomorrow's contract? And after you model those contracts for that's been signed off by the CFO, then how do you put in operational efficiencies? And I think that is important. Then how do you help staff productivity? How can you track revenue from payment productivity tracking? And then it gives you transparency and visibility. And then as you start building up to the accelerate, then how do you accelerate from reimbursement cycles, decision making, and contract evolution? And then the biggest thing is revenue recovery. That's what it's all about. All the stuff that I talk about is how do you identify that revenue recovery? And then workflow integration. And then the key thing is how do you improve financial accuracy? Then also, too, how do you bring in more cash in the door with cash flow management? Compliance, the ability to calculate those government payers, not just the government for Medicaid, Medicare, and TRICARE, but also all those MAs, those Medicare Advantage plans or Medicaid Advantage plans. Patient care through more resource allocation and contract terms and negotiation power. So those are some really key things from the outcome and benefits from that standpoint. But one of the things I talk about from the attributes is that when you start looking at it is precise, the ability to model contracts for forecasting and future net revenue. I think that is important. So as you're looking at your data and everybody has to negotiate contracts every year, how do you model those scenarios? But one of the key factors within contract manager is the accuracy. Think about all the contracts that you have today, commercial, governmental, from that standpoint. Contract manager can calculate all terms related to contractual agreements. So no matter if they're simple percentages to very complex contracts with DRG base to stop losses to what if scenarios to cost plus language, all that information, or to even to the Anthem COPS contracts is a good example that pays like Medicare, but uses the Anthem's fee schedule for that hospital locality. And think about the experience, right? We have leveraged the industry experience in the contract management for health organizations. I think that is key. And then actually, at the end of the day, though, is actionable insights, provide customized reports and analytics to optimize revenue. So while contract manager is calculating every day expected reimbursement, expected discount, and can track and trend, analytics sits on top of that engine, and you can have KPIs, payer report cards, so payer reporting, payer compliance, and payer trending. You can track that revenue. So I always say as a good example, if I sign a contract today's date, and I don't want to wait for 3 or 4 months later to start finding a problem. I can start tracking and trending days of payments and days outstanding based off that contract, but also am I getting paid? Which contracts are not paying me correctly? Is it a problem in the ER versus outpatient surgery or a certain physician or a certain practice? I don't want to wait months. I can identify that right away with analytics to ensure that optimized revenue and ensure compliance. But, when we start looking at it from a proactive approach to managing your payer contracts, you can't be certain if your payments are accurate. And one of the things that we see with our many customers that we have today is 50% of the payment discrepancies are due to underpayments. That could be they're upcoding or downcoding. They're not paying a certain way. We can track and trend that. $752,000 in lost revenue for a provider with an average payer mix. So if that is a small hospital system, that's big revenue. And if you're a big organization with multiple facilities, that $752,000 is probably going to be 2 or 3 times that. And then also think about 2 to 3% of delayed or lost revenue due to contractual underpayments. How do you track and trend that? That is key. So contract management, by loading all the contracts, calculating daily, we could track that utilization. So that really brings me to the value drivers. And I think this is very important. So avoid unidentified payment variances, which is key by calculating expected reimbursement for all contract scenarios. and not in comparing it to the actual payments. And it's not just the actual payments, but it's the actual discounts and any type of other transactions. So contract management, the accuracy that we drive is plus 98% of contract accuracy across all payers. So think about that. If you're a Blue Cross in California to Blue Cross in Texas or Florida or Michigan, they all pay a different structure, different methodologies compared to your Medicaids or your Medicares. All that logic is loaded within contract management. So from that point, the accuracy that we drive for both hospital and professional is that 98% or higher percentage. Optimize contract negotiations. I think that is key. So remember what I was talking about, finance, managed care, PFS. So modeling various contract scenarios is key. So all of the Epic hospitals that we have today that utilize contract modeling for negotiation is here, right? How to grab today's contract and run a model to tomorrow's contract. And I'll talk about that in a little bit too. So we've had one client reduce negotiations from several months to less than a couple of weeks. Now we know that they can take longer, but the accuracy that it drives, so every time you run the model. So we had a customer of ours, a very large organization, said, John, the payers are always throwing us curveballs, hoping we make a mistake. And we're trying to throw them a curveball, hoping they make a mistake. And basically what we want to do is make sure we don't strike out. So as the payers throw you curveballs and your models, you can see every type of iteration of what they're trying to do to make sure you're getting every dollar that you're trying to negotiate. And then the biggest thing is we see about a 5 to 10x ROI on historical performance is using contract manager modern analytics. So as I build this out, and I think this is very important, right? So how does contract manager work? First of all, I'm going to kind of start from the right. We're going to bring in all your payments and adjustments from the patient accounting system into contract manager. So all the data is coming in every day. We also bring claims from your claim scrubber. So the 837s, 835s, or the 1500s, payments and adjustments into contract manager. Then we're going to load contracts back to the left. We're going to load all your payers based off the terms and conditions, based off that payer methodology that you negotiated with. So the nice thing about contract management, we really have two tracks for this. Either we can load it and take on that labor cost, or if you wanted to do it as well, you can do that. The majority of our customers today decide that you guys are the experts, you've been doing it the longest, you guys load them, and then we'll just we'll do the final approval. And some customers will say, hey, you get all our contracts loaded first, and then we'll take over the contract loading. So it's really what is the best fit. And then in the middle part of that is that we're going to bring in your claims from your claim scrubber. So again, we're very agnostic. So if you're using our claims management system to another system like a change or any different type of payer, we pull in all that post-edit claim data. So every day we calculate net revenue to the contract from the claim. And then when the payments come in, we can compare the expected versus the actual. And not only can we compare it, but we also compare it to the actual 835. So that way we can show you total expected payment, insurance payment, and patient liability. On the hospital side, as well as the ambulatory side, where we break it down by line item based off physician specialty. So as you try to, avoid unidentified payment variances, contract manager then becomes your source of truth. So a lot of times if a health system is going to use their own patient accounting system as their daily workflow, they would use contract management as that source of truth. So then how do you understand trends, right? So if I'm not being paid correctly, if outpatient surgery is not paying me with Rev Code 360, is it just on one payer across multiple payers? And do I need to look by Rev 360 and a CPT code? They're not paying me. So I can drill down to that detail. And then how do you reprice, identify exceptions? I think that is very important. And then how do you flag potential repricing exceptions? So again, contract management does become that source, that one engine to accurately calculate total revenue that is owed by all payers, commercial, governmental, and all the patients, both hospital and physician-based. And then as we look at, so if you think about contract manager as the engine, right? These modules that set next to it or underneath it is contract modeling, contract analytics or analyzer, reserve management, and price transparency. So contract modeling is probably one of my favorite subjects because it allows the health systems to model today's contract to tomorrow's contract. Think about that what if scenario. What if I want to import a CDM or change up a term, change up a methodology, compare different payers to utilization, or retro back and look at prior contracts that you negotiated to see how they fared out. So contract modeling is part of manager. Contract analytics is Power BI, and that really gives you immediate insight to payer performance and contract performance. You can do customized reports with analytics. You can create custom reports. Again, finance, managed care, PFS. Deep insight on reimbursement and payer productivity and yield is very user-friendly since it's Power BI. Reserve management. So think about it again, back to my three things: finance, managed care, PFS. Finance can use reserve management under contract management to calculate month-end reserves. So instead of using paid claims to drive a PCR, percent charge ratio, you can use contract management to actually calculate all calculations for month-end processing. It's an automated reserve recognition, identifies lost revenue. And also it speeds up the time to calculate net revenue. So again, we do utilize a step-down methodology using contract manager first, then supplemental billing for concurrent coding, then PCRs and per diems. And then lastly, the new thing that came out a year and a half ago was price transparency. So again, think about this. As you talk about it, to look for underpayments, to do a month-end reserve, and to do contract analytics and modeling, we have a price transparency solution that can actually generate a machine readable file within contract management. It takes no IT requirements or setup. So within that, we already have the contracts loaded within contract management. So it complies with CMS pricing rules and regulations, and it generates that cost for each item that's serviced. So the machine readable file is amazing fast from that perspective. So a lot of times people are taking months to build this out, or they got to go to an outside vendor and pay all this cost. Within contract management, it already resides inside of that. So as I start looking at one of the key benefits under contract management, it's really modeling. And I think this is where a lot of our customers, a lot of Epic shops use this today. Out of our 800 hospitals, probably 125 or 130 Epic hospitals use modeling. So what if scenario? Think about what if. What if I want to change up a structure, change up a methodology, change up any type of structure that you think of to run a model? What if, right? Side-by-side comparisons, easy modeling comparisons. So for every model that you generate, it will show you side-by-side comparisons for that financial impact. Again, back what I was saying earlier, is that payer trying to throw you a curveball? If you're expecting a 6% increase, but you only got a 2%, that's because they're putting more money in inpatient versus outpatient or different scenarios. Or a better scenario is, if you have outpatient surgery with all these groupers 1 through 9, and if the payer says, we're going to give you more money in groupers 7, 8, 9, because those are the high dollar procedures, sounds great on paper, but if all your volume is in 1 through 5, there's the curveball they're throwing you. So then how to start looking at it from a forecast contractual and revenue, and then think about it from an analytics perspective, pay report cards, centralized contract repository, and profitability. Those things are key. So modeling is built with inside contract management. So it allows you all of that structure. Again, what does your data say that the contract says differently? And then analytics is that hood of the engine, right? So think about that intelligence, diagnose denials, look at contract terms and errors, and try to track that information. Think about KPIs, high level compare actuals to targets, right? Think about that KPIs from executive levels to different methodologies. Payer report cards, payer compliance, payer trending. Drill down to any of the payers, find that utilization across the core data. Customized dashboards. Another thing that we have is Medicare benchmarking within Contract Analyzer. So think about if I wanted to say, how is my Blue Cross for utilization of a year, and how does Medicare benchmark to that? So Contract Analyzer will show you the Medicare benchmarking. That is so phenomenally amazing because you don't have to run a model. Analytics will show you that information. So Contract Analyzer sets on that engine to where you can create custom reports for finance to managed care to PFS, and then you can track and trend that utilization and create custom reports. And then some additional offers that we do from reserve management, like I was talking earlier, to actually calculate your month-end reserves for the finance. We do have a prospective episode manager that if you said, how do I look at a bundle or a transplant, where Contract Manager is a fee for service engine, our PEM, prospective episode manager, calculates those bundles, right? So how do you track a transplant from a pre-transplant to a transplant to a post, or specific or a certain bundle? So all that is different offerings. And then, the price transparency from CMS compliance, reimbursement visibility, and how to maximize revenue. So that is very key from that key component of that to create that machine readable file. And then some of the highlights that I want to talk about. We've had some people identify underpayment 6 to 8 million consistently year over year. We had one health system identify increased collections over $500 million over 10 years. And then one customer that I know very well reduced their negotiations less than 3 weeks, that it was taking them several months to do. So if you want to learn more, I'm the guy that does this. So John Wallace, if you need more information, please let me know. I'll be glad to give you a demonstration. And I thank you very much and have a blessed day. Thank you so much, guys.